Hi, in this video we are going to discuss about fetal circulation. So what are the prenatal and postnatal changes happening in the fetus? In the developing fetus, there is a totally different form of circulation other than the adult, because the fetus is usually present inside the uterine cavity. Inside the uterine cavity, we don't need any oxygen or the carbon dioxide through the inspiration or the expiration, because it is not possible. So there is no need for the lungs to inspire or expire. So we need oxygenated blood for the better growth and development of the fetus. So we can get the blood from the placenta, from the maternal blood supply. The maternal blood supply, it goes through the placenta to the umbilical vessels, and through the umbilical vessels it enters into the fetal circulation. Mainly we can see, when we can see the umbilical vein, it supply about 80% of oxygen to the whole body. But when the umbilical arteries, which collect the blood from the whole body and carry again to the placenta for the diffusion of the nutrients and oxygen, it carries only about 50% of the oxygenated blood. Here, consider it as the placenta. So these are all the chorionic villi. When the umbilical artery, which collects whole of the blood from the body, enter into the chorionic villi, where they get the nutrients and oxygen from the maternal blood vessels and re-entered into the umbilical vein. So from the umbilical arteries, about 50% of oxygenated blood enters into the chorionic villi, where they get oxygenated and re-enters into the coronary circulation. So this is the schematic representation of the fetal circulatory connections. So from the placenta, the umbilical vein, which carries the oxygenated blood to the liver, where it supplies the liver, a few amount of blood supplies the liver, and maximum amount of blood enters into the inferior vena cava through the ductus venosus. So from the IVC, inferior vena cava, the oxygenated blood enters into the right atrium. It's supplied into the left atrium and also into the right ventricle. So once it enters into the right ventricle, it goes through the pulmonary artery and enter into the lungs. Here the lung is not functional, so there is a very minimal amount of supply of blood to the lungs. So maximum amount of blood is supplied to the left atrium and then to the left ventricle, and through the aorta it's supplied to the whole of the body. Here we have to note some important parts which is useful for our next slides. First one is the ductus arteriosus, which connects the aorta with the pulmonary artery. Second one is the septum primum and septum secundum, and also the foramen ovale. So these parts are very important for our future slides. In this prenatal circulation, the oxygenated blood from the placenta through the umbilical vein enter into the liver, where the few amount of blood is entering into the liver for the blood supply, and maximum amount of blood enters into the right atrium through the inferior vena cava. So from the inferior vena cava, here we can get the oxygenated blood, and from the superior vena cava, here we can get the deoxygenated blood. So both oxygenated and deoxygenated blood is mixed here. From the right atrium to the right ventricle, this mixed blood enters into the right ventricle, and also the mixed blood enters into the left atrium, because right atrium has high pressure. It always pumps from the right atrium to left ventricle, left atrium. So from the left atrium, it again pumps into the left ventricle. So from the right atrium, right ventricle, the mixture of blood, the oxygenated and deoxygenated blood, again pumped into the lungs through the pulmonary artery. Here the pulmonary artery have high pulmonary vascular resistance, because we don't want a high amount of blood to the lungs, because it does not functioning. So when we need only a little amount of blood, hence there is an high pulmonary vascular resistance, so we only supply a minimal amount of blood. So the maximum amount of blood again pumped into the aorta through the ductus arteriosus. So from the left ventricle, the aorta taken the whole amount of blood to supply all the organs. So from all the organs, the collection of the blood again re-enter into the placenta for the oxygenation and the diffusion of the nutrients, and again supplying the whole body. So what are all the mixtures? Where all the mixtures of both oxygenated and deoxygenated blood happens? The first one at the liver, at the ductus venosus, we can have the mixture of both oxygenated and deoxygenated blood, because here is the portal vein which supplies the blood to the liver. So here the first place or the first site where we get the mixture of both oxygenated and deoxygenated blood. So from the ductus venosus through the inferior vena cava, when it enters into the inferior vena cava, here from the lower body again the deoxygenated blood enters. So this is the second site of mixture of the deoxygenated and oxygenated blood. So from the inferior vena cava, when it enters into the right atrium, here is the superior vena cava which enters into the right atrium. So this is the another place or another site for the mixture of oxygenated and deoxygenated blood. So again from the right atrium to left atrium, again here is the mixture, because the pulmonary artery also have oxygenated blood. So this was the site for the mixture of the right atrium to left atrium. There is a mixture of both oxygenated and deoxygenated blood. So from here the pulmonary artery again supplies the deoxygenated blood to the aorta. So this is another site for the mixture of both oxygenated and deoxygenated blood. Here we can see what are all the changes that occurs in the infant circulatory system once it comes out. So what are all the postnatal changes we can see here. So after the cutting of placenta, the umbilical veins and the umbilical arteries is totally disconnected from the placenta. The placenta is totally disconnected from the mother's uterus. So lungs start functioning at the first gasping of the child, and the reversal of shunt happens. So what are all the changes? First one, the infant take the first breath. What are all the changes at the first breath means the increased amount of partial pressure of the oxygen and secretion of the bradykinin and reduction in the prostaglandins E2, which constricts the ductus arteriosus. So once the ductus arteriosus is constricted, the aortic pressure got increases than the pulmonary artery pressure. So previously the pulmonary artery pressure is higher due to the pulmonary vascular resistance. But here once the constriction of the ductus arteriosus is happening due to the increased partial pressure of the oxygen, due to the infant breath taking, so the aortic pressure got increased than the pulmonary artery pressure. This will produce the reversal of the shunt. So from the aorta to the pulmonary artery, now the reversal of shunt will happens in the constricted blood vessel called ductus arteriosus. So once the ductus arteriosus get constricted, the reversal of shunt happens. So the pressure in the aorta gets higher. It pushes the blood forcefully again into the pulmonary artery through this ductus constrictor ductus arteriosus. So this is the first shunt reversal. Then second, here the septum primum present here. Once the pressure increased in this left atrium, it pushes the septum primum towards the septum secundum, towards the interatrial wall. So when it forces the septum primum to close this foramen oval, what will happen? The septum primum closes the foramen oval. This is due to the reversal of shunt from the left atrium because it got higher pressure, because the lungs are working, the pulmonary veins which comes from the lungs which supplies the blood into the left atrium, so the pressure got increases, which forces the septum primum to close the foramen oval. What are the adult remnant of the fetal circulatory structures? The first one, which is the remnant, is fossa ovalis, which is the remaining structure of the foramen oval. Once the foramen oval is closed, the fibrosis of this foramen oval, which creating the fossa ovalis. To close the foramen oval, will happen at the first year after the childbirth. It will happen, the foramen oval will close after the first year of the childbirth. Second one, ductus arteriosus, which got converted into the ligamentum arteriosum. The umbilical vein which enters from the placenta into the liver, the extrahepatic portion of the umbilical vein will change or converted into the ligamentum teres. The remaining part of the ductus venosus will converted into the ligamentum venosum. The last umbilical arteries, the proximal portion of the umbilical arteries will change into the internal iliac arteries, and the distal portion of the umbilical arteries will change into the medial umbilical ligament. Thank you.